Go ahead.
Greetings, Cherry Creek High School Medical Careers class. My name is Kathy Schockly, and I'm the rehab manager here at Highlands Ranch Hospital. And I'm going to talk to you about three different rehabilitation professional careers that may interest you as you explore this journey. So let's see what I can do to advance the slides. There we go. So rehabilitation. Rehabilitation is the action of restoring someone to health or normal life through training and therapy after an accident, an injury, or illness. There are three disciplines we're going to talk about today. They are physical therapy, occupational therapy, and speech therapy. By background, just full disclosure, I'm a physical therapist. So one of the great things about rehab professionals is that they can work in a wide variety of settings. So you may know of rehab professionals who work in the schools with young kids, who work in secondary schools like high schools, who work in colleges. There's a lot of options to work in the schools. You can work in the outpatient clinic setting. You can work in the sports medicine clinic setting. You can work in home health, which is a very personal way of working with your patients. You can work in a hospital like I do. You can work in a skilled nursing facility, which is also called a nursing home. And you can work in a rehab unit, an acute rehab unit. And that's the type of place where people go to for a designated length of time to really get intensive therapy to recover from an injury or illness. So first we're going to talk about physical therapists. So physical therapists are movement experts who work to really progress someone's quality of life and improve their quality of life through exercise, through hands-on therapy, and patient education. Physical therapists provide a lot of education and teach their patients how to prevent or manage, prevent injuries or manage further injury or manage their condition so that they can achieve long-term health benefits. So physical therapists can work on the entire spectrum from injury prevention, strength training, flexibility work to optimize peak performance like you might see in an outpatient setting. And then physical therapists can work on the rehabilitation end, which is what happens after injury or illness. And you work really to get back to a certain level of function or to get back to your previous mobility. So physical therapists have great variety in their career options. So here in the slide, you see a picture of a physical therapist working on walking with a patient. You can see on the top right corner a physical therapist working in an outpatient clinic setting where they're working on hamstring flexibility. You see in the bottom left a physical therapist working on someone's knee range of motion and stability to improve their gait pattern. And then on the bottom right screen or picture, you see a physical therapist working with someone on their balance and also their core strength. The next profession that we're going to talk about is occupational therapy. So the main focus of occupational therapy is what we call activities of daily living. So occupational therapists work with people all the way from birth to end of life at, the geriatric years, all through the spectrum on improving people's ability to perform their activities of daily living or their self-care or anything that they do in their normal routine as independently as possible. So things that we describe as activities of daily living are things like showering, getting yourself dressed, anything you do for recreation, eating, actually bringing a utensil to your mouth and eating. Driving falls under occupational therapy. Mobility can fall under occupational therapy. Play is incorporated a lot with occupational therapists in the youth years, in kids. That occupational therapists can work on activities like preparing meals, household activities, managing the home, and even taking care of others. So occupational therapists really work on a very broad canvas of ways in which they help a patient optimize their independence with their daily activities. So occupational therapists can work in the schools. We talked about that a little bit, and you'll see that a lot in elementary schools and preschools. Occupational therapists also can work in acute rehab facilities or hospitals, working on things like standing balance to enable a patient to stand at the sink and brush their teeth, or get in and out of a shower, up and down from a toilet, get themselves dressed, all sorts of activities that patients do in their daily routine. Occupational therapists also can work with patients on things like tasks. Like, say you needed to go to the grocery store, there are a lot of components that go into going to the grocery store. That's a daily task for some people, and occupational therapists can work with people on problem solving through those types of tasks. The third profession we're going to talk about is a speech and language pathologist. And this profession I want you all to really hone in on, because this is a profession that we think we know what a speech therapist does. We think it's about how a person speaks or sounds when they speak, but speech therapists actually have an entire range of treatment, assessment skills that go far beyond simply the speaking piece. So speech and language pathologists work to prevent, assess, and diagnose, and then treat speech, which is me actually projecting the words out, right? Language, which is which word I choose and meaning behind words. Social communication, cognitive communication, and swallowing disorders as well. So speech therapists have a great range of things that they can work on with patients. For example, our speech therapist here at the hospital works with, she may work with her first patient on swallowing, right? Actually, the physical act of getting food from the mouth down their throat, right? Because it takes muscles to do that, and it takes strength and coordination. So their first patient may be someone they're working on swallowing with. Their second patient may be someone they're working on a memory task with. Their third patient may be someone they're working on a word task with, in terms of choosing the right word, or understanding a word, or actually expressing that word. And then their fourth patient may be someone who, say, had a head injury, and they're working on problem solving skills, or they're working on safety in terms of their thinking. So keep in mind speech therapy when you think about the rehab professions, because it's a very unknown, underutilized, and unexplored profession. It's a great profession out there. So here's a couple pictures of speech therapists in action, right? This is the one that we all think of, right? We always think of the speech therapist who works in the schools and is teaching a child how to say certain sounds. For example, a lot of kids have trouble making the S, the sound, and so speech therapists teach the child how to make that sound. This is an example of a speech therapist working on a patient's swallow. And one of the really cool actions that a speech therapist does, or assessments that a speech therapist does, is called a modified barium swallow study. And the speech therapist has the patient drink or eat foods or liquids of different consistencies, different thicknesses, that are filled with a substance called barium, which then shows up on an X-ray. So this dark line coming down through this image is the patient swallowing that liquid, going down their esophagus, and making sure that that liquid isn't spilling over into their trachea, into their lungs. So speech therapists do this too. It's one of the coolest things they do. So here's a great slide showing all the different things that speech therapists do. They can work on their cognitive areas as well. Cognitive are things like thinking. So attention, memory, problem solving, reasoning, processing, which word to choose, being able to have good endurance to think through something. So think like getting through your SAT or your ACT requires great mental endurance, or getting through a really long exam requires great endurance. But it also can be much simpler, like being able to attend to a 3-step process, right? So that requires mental endurance as well. And then executive function, so higher level functioning, things like balancing a checkbook or paying bills or staying up on things that you need to do to be able to keep track of your finances. So speech therapists do a lot of great things. This again is another slide showing the wide range of skills that speech therapists have. So I want you to remember that when you hear about the speech therapy profession, that it's not just about the sound or articulating words. It goes far beyond that, and it involves swallowing, it involves thinking, it involves memory, safety, lots of great things that a speech therapist does. So now we're going to talk about the levels of education required for each of the professions, and then the average salary. And forgive me, this is about 2 years old, so maybe not. The salaries may have increased a little bit, but it is a smidge dated. So let's talk first about physical therapists. So currently, a physical therapist is required to get a doctorate level of education, which means that you do 4 years of undergrad, and then you apply to graduate school, and most graduate programs are about 3 years. It's highly competitive to get into a graduate program or a doctorate program in physical therapy. One of our programs here in the state of Colorado is at the University of Colorado, up at the Anschutz Medical Campus, and their acceptance rate is about 10%. So about 1 in every 10 candidates who applies gets into that school. The average salary for a physical therapist working in the state of Colorado is about $84,000. The next profession is the occupational therapist. So the occupational therapist is a master's level of education. Now I say that, and some schools are transitioning to a doctorate, so it may move to a doctorate at some point. But it's a master's level, which means you do your 4 years of undergraduate in some sort of science field, just like physical therapy. You can do it in biology, you can do it in physiology, you can do it in human development, you can do it in a wide range of science-based majors for your undergraduate, but you do want to make sure that if you're looking at any of these graduate schools that you find out what their prerequisites are and that you incorporate all of those prerequisites in your undergraduate education. After you do your undergraduate education, then your master's program is about 2 to 3 years in graduate school. Again, it's a highly competitive process. One of the top OT schools in the nation is right here at CSU, and their acceptance rate is about 13%. The average salary for an occupational therapist in Colorado is about $86,000 a year. And then lastly, we're going to talk about speech therapist requirements. So again, a master's level requirement for education, about 6 to 7 years total. So you do your undergraduate and then you do your graduate degree. It has about a 20% acceptance rate and an average salary of about $84,000 as well for a speech therapist here in Colorado. Now, when we talk about salaries, it's important to note that traditionally, because Colorado is a very active, vibrant place to live, people who tend to go into the therapy world, physical therapy, occupational therapy, speech therapy, tend to be people who want to live in the state of Colorado. So the demand for jobs here is that there are typically more therapists than there are jobs. Now you flip that around and you go to somewhere like, let's just say Alaska, or down south like Alabama or Louisiana or Mississippi, and the pay is much higher. You can figure out the quality of living if that's something that works for you, but that's kind of the way it works in Colorado, is that because there are so many therapists who want to work in the state of Colorado, the pay isn't as high as other places. So one of my absolute favorite things about being a therapist, and like I said, I'm a physical therapist by trade, is when we are able to take all three disciplines and work all three disciplines with a patient at the same time. So a lot of times physical therapists and occupational therapists will work together with a patient so that they work on different aspects at the same time. So for example, a physical therapist and an occupational therapist might be working with a patient who's had a stroke and had impaired balance, standing at the sink, and maybe they need to work on reaching for a toothbrush and brushing their teeth, but while at the same time work on their balance and making sure that they're steady on their feet. So we can do that together, right? Another thing we can work on is something like before a patient's even able to walk, we often work together to have the patient sitting at the edge of the bed in the hospital. And this requires a lot of balance and upper extremity strength and attention to task and all sorts of components going on at the same time. So we'll have both a PT and an OT working together. But sometimes we get incredibly fortunate and we get to have all three disciplines working with a patient at the same time. So I'm going to tell you my favorite therapy moment out of my career. And I've been doing this for, oh boy, let's see, 24 years now? No, 22 years. 22 years now. I don't need to be any older than I already am. So 22 years as a physical therapist, and the best moment I ever had working was we had a patient who had a very significant injury, very significant. He had a spinal cord injury. He was on a ventilator, which was helping him breathe, so he couldn't speak. He had a head injury as well, which is a brain injury because of the trauma. And we were fortunate that he was probably maybe 10 days past his original injury. And it was time for us to try getting him up to a chair. So we had worked on sitting at the edge of the bed. We had worked on different components of his balance and activity tolerance, but we were finally going to get him to a chair. It was a really big moment. Now, because he had a spinal cord injury, he could not use his legs at all. And often when you're paralyzed from in his case, from his lower ribs down, your balance is significantly impaired too. And so it took both the occupational therapist and I both sitting with him at the edge of the bed to get him stable at the edge of the bed. Now, I had mentioned earlier he was on a ventilator, but he had reached the point where he was off the ventilator, the breathing machine for him, and he had what was called a trach, which is a hole in your neck that speech therapy will come and put a cap on, and it has a little valve in it, so it lets air go out so the patient can speak and allows the patient to have a voice again. And so this patient, the occupational therapist and I transferred him or moved him from the sitting at the edge of the bed into a wheelchair. And then the speech therapist came in, and the speech therapist then put this cap on him and enabled him to speak for the first time in 10 days. And the three of us were in there working together, making sure his oxygen levels were good, making sure his blood pressure was good, all sorts of things going on. His nurse was obviously in there as well, because his nurse was critical, making sure he was medically stable. The respiratory therapist was in there as well, because the respiratory therapist was making sure his oxygen levels stayed good. And the speech therapist put the cap on. We got him all set up comfortably in this wheelchair for the first time. And his wife was in the room, and his wife said, "Are you okay? How are you doing?" And it was the first time she was able to hear his voice in 10 days after what was a horrendous situation. And his words, his simple, very simple words were, "I love you." And he barely got them out, but he got all three words out. Every single person in that room, the nurse, the respiratory therapist, the PT, the OT, the speech therapist, all of us were just sobbing, right? It was such a gift and such an amazing experience to be a part of this person's journey that went from the patient, being if not on death's door, being very close to death's door. This lovely woman, his wife, wondering if he was going to live or not, and then seeing this moment between the two of them. It was incredible. So every day is not like that. Every day you don't get to have these incredible experiences. But what you get to do as a therapist is you get to work with patients to get them back to their best state and function. Whether that happens on a really high level at a sports performance level, or whether that happens on a very minimal level, like sitting up on their own, or being able to feed themselves, or being able to breathe on their own and speak through a speaking valve. You know, we get the privilege and the joy of going along with our patients on this journey, and it really is a great experience. So that being said, I'm sure you can see I still to this day have a little bit of emotion behind that great moment. It's something I'll never forget. But I want you to think about this, because this is your challenge and your task. And that is that everybody has a calling in life. And your real job in life is to figure out as soon as possible what your calling is, who you were meant to be, and figure that out so that you can go and be the best possible you that you were meant to be. We're always searching for our careers, and we're trying to figure out, what do we want to do in life? What do we want to do this? Do we want to do that? But the way I equate it is the best people, the best that you can find your calling and match that with your career makes it so that your job is not a job that you don't enjoy, or it's not a job that you're burdened with. If it's your calling and it's your passion, you will be happy going to work, and you will feel privileged to get to do what you want to do. Medicine is like teaching. Medicine is something that you should do if it's your calling. You shouldn't go into medicine because you want to make a lot of money, because actually it's not the best bang for your buck. Sorry, probably shouldn't have said that, but I'm just going to say it anyway. It really isn't the best bang for your buck from an education and a return on your investment standpoint. You should go into medicine, or you should go into therapy, or you should go into healthcare or nursing or teaching because it's your passion, and it's because it's what you want to do and you can't see yourself doing anything else. And that is what makes a great therapist. That's what makes a great teacher. That's what makes a great any profession, is the people who do it because it's what they believe at their core of their being. It's what they were meant to do. So if you have any questions at all about any of the rehab professions that I discussed earlier today, feel free to reach out to Mr. Stirrup, and he can connect you with me. I'm happy to answer any questions. It's a great set of 3 professions. Absolutely love it. But again, it needs to be your passion. So go out and find your passion. That's what matters.
And I will have a place for the kids at the end of the video. They can type in questions, and I'll send you an email of the questions that they have. And
awesome.
I've been really proud of the kids. They have been kind of coming up with a lot of really creative questions. I think it's a lot of fun. So
good.
Well, thank you so much for this. I'm going to go ahead and stop recording.